Uh,
Please start.
so now we are to case 5. She's a 58-year-old female, known case of hypothyroidism. She has mainly complaints of lower back ache radiating to left lower limb. She has a long history of 15 years. Uh, Currently also she has right buttocks and with radiation to lower limb, and she also have upper limb symptoms mainly towards left side. But she is debilitated by her left lower limb symptoms. So we will be addressing that today. Otherwise, her examination is within normal limits. Reflexes, hyperreflexia is there in knee and ankle. On imaging, we can see kyphosis in early kyphosis in cervical spine, and loss of discal spaces is there. And in lumbar spine also, we can see loss of discal space here. On MRI, we can see L4, L5, and L5S1 disc, and same we can address on axial cuts. Now I will hand over the mic to sir.
Dr. Dureja,
Mic is coming to me. So this is a patient who has, as you have seen in the history and on the
can
MRI.
you increase the volume for Dr.
Yeah.
Dureja?
Okay.
Ravinder?
ठीक है, am I audible now?
Yes, sir.
So okay, so you can see by the history and MRI that this patient has predominantly back pain, and there is a radiating component on the left side. There is a L4-5 disc bulge which is causing radiculopathy, but primarily she is more concerned about the pain which she gets in the back on sitting posture. So if even in an MRI you can see there is a fusion in the L4-5 facet joint, and she has all the signs of, I mean, like hyperextension increases pain, local tenderness is there. So all the signs of a severe facet arthropathy. So we are targeting the facet joints by doing the radiofrequency ablation of L4-5 and L3, L4 roots, the median branches, and we will be targeting the radicular component by doing L4-5 root block. So we are doing a cool RF of L4-5 and L3, L4 medial branches. Over to Dr. Dhruv, please. Yeah.
Okay, sir.
So you can already see on the image that we have given some local anesthetic at the eye of the Scotty dog. Since we are using a 17 gauge needle, uh, this is a 17 gauge needle for cooled RF. We have given this local anesthetic so that patient does not experience pain because of the thick bore needle. And then we will be directing our needle to the eye of the Scotty dog.
Right.
So, and this you may not be oblique because this cooled RF produces a lesion of 15 to 20 mm, unlike standard RF which produces lesion of about 5 to 10 mm. So big lesion, so you can be spot on also. You can have a tubular vision. So now you can see this is like exactly on the eye of the Scotty dog. The dorsal medial, the medial branch from the dorsal rami crosses this and then supplies the facet joint. Even the facet joint, you can see there is a infusion in the facet joint, so it's a diseased facet joint. So we hit the bone, and then we check it in the lateral position. So this is the final position of our needle on the eye of the Scotty dog for the medial branch, the branch of the dorsal ramus, which is supplying the L4-5 facet. So once we put the needle there, we turn lateral.
So it is right now we are hitting the bone, sir?
We are hitting the bone, yes, we are hitting the bone, that groove from where the nerve comes in.
Right.
Yeah. So that's the groove between the superior articular process which merges with the transverse process.
Right.
So now in the lateral posture, you will check because it is important, although we are hitting the bone, but you still have to see whether you, because if you cross that groove, you may go into the foramen. So, yeah, we are not in the foramen. थोड़ा सा नीचे करेगा सियाम सियाम नीचे करना सियाम नीचे अच्छा stable up please so just to check we are not close to the nerve. In any case, we are going to do the stimulation also. Bus check, please check. Yeah, this is exactly the place where you want the needle to be, and now we are going to do the stimulation. So we cannot deeply sedate the patient because patient cooperation is important while doing the stimulation. So we tell her that we will be doing the stimulation, and there should be a local, yeah. So impedance, can you check? Somebody can show the machine, please.
What are the parameters and what is
So you check the impedance. 715. Yeah. So we want to. Yeah. Coming down. That's okay. Around 500. So we check the impedance
what should normally
around 500, maximum 500 to 600. Shoot, please.
so here it is like it's coming 800 900 we need to reposition
Yeah,
it
we are repositioning now.
till it
No,
is
yeah.
very close to the nerve.
Absolutely. No, the bone.
To the
Here the nerve is not in.
to the sorry to the bone.
Yeah, to the bone. ठीक है. Now it's 630. This is fine. Yeah. छोड़ दीजिए. So we can sort of, we can in the interface between the bone and the needle we can put some saline to see the interface. But yeah,
What is the impedance right now, sir?
it's around 800 to 900.
Okay.
Yeah. So now it's yeah. Now the impedance is gone below 300. 300. So
Okay, so you put in saline.
yes, but just put in saline between the interface of bone and the needle. So
Okay.
that takes care of the impedance. So now we do the stimulation. So first is the sensory stimulation at 50 hertz, and as we told in the morning, 0.4 to 0.5 volt. You check whether there is any radiation of pain to the leg and all. Although you have confirmed under lateral, you have seen under AP, but still you have to do a sensory and motor stimulation. आपको कुछ करंट आ रहा हो तो बताइएगा. We are starting now. धीरे धीरे. आप कैमरा है इधर, कैमरा है इधर.
हाँ sir, we can see.
हाँ जी. 0.4. पैर में तो नहीं जा रहा जी. बिल्कुल नहीं. और डालिए. और जाइए. कहीं पैर में कहीं लोकल आ रहा है वहाँ पे. ठीक है जी. और बढ़ाओ. हाँ, आप कहाँ पे आ रहा है?
पीठ में आ रहा है ना, पैरों में तो नहीं जा रहा. कमर में ही है ना, इनके पैर में नहीं जा रहा.
अच्छा, कह रहे हैं कि पीठ में ही है पर पैर में ज़्यादा तो नहीं फील हो रहा. ठीक.
What should be the ideal response, sir?
Till about 0.5 there should not be any response, only local response, that's it.
Okay, okay.
कुछ नहीं है. So she doesn't have anything. So then we do a motor. So motor you may have some fasciculations locally, but again, yeah. आराम से. जाओ. मोटर है ना. जाओ. Yeah. So now you can see the twitching here. आप हाथ हटाइए. और बढ़ाइए थोड़ा. So you may see, yeah.
No sir, these are electrospiny group of muscles.
Yeah.
Multifid as well. That supplies the median branch.
Yeah.
So it shows that we are at the median.
So this is, you can see these fasciculations, which is the erector spiny muscles fasciculating. So yeah, this is again confirms that you are at the median branch.
Right, sir.
Right? ठीक है जी. Stop please.
एक बार फाइनल शूट करिए. We are way outside.
Yeah.
वो जो है that is the tip of the needle. उसके आगे जाता है the probe. Point less than point. Right? ठीक. Fine. Sir, do you want to satisfaction?
Yes, satisfied. So after you have you are satisfied that you are on the nerve, then you, because the ablation part is painful, so you can give some local anesthetic before you start the ablation, but only after confirming that you are at the median branch. So just about 0.5 ml of, not much, don't give very much of local anesthetic, just 0.5 ml, because it can spill into the root and later on cause a problem to you. So
Right.
just about 0.5, 0.4 ml of lignocaine or bupivacaine. बस ज़्यादा मत दो. ठीक. Right. So we'll wait for the local anesthetic show the effect. दूसरी needle डालनी है अभी. आ गया. पकड़ लो. यहाँ पे थोड़ी पोजीशन नीली चेंज हुई. ठीक है. ठीक. चलो शुरू करो. So we are now starting the lesioning. Now the cool RF has a special property that the temperature will not go beyond 60 degrees.
Okay.
Unlike standard RF where you can go up to 80 and 90 degrees. Pulse RF is 42, but here it is, and you can see some water flowing. आप वो machine दिखाइए please. So that's cool RF basically means that the temperature are cooled off. So you don't allow the heat to develop at that particular place, so that no damage to the structures is done. Yeah.
And we see the time is set to 2 minutes 30 seconds, sir.
Yes.
So that.
So the first lesion will be for 2:30 minutes, 2 minutes and 30 seconds, and now the lesioning is going to start now.
Right, sir.
Once the temperature is 60 degrees. Now, so now the lesioning is starting. As you see the graph.
Yes.
Now. So the countdown has started now.
Right, sir. And does the patient feel anything?
No, we have already given local anesthetic, so she is not feeling any pain. आपको कोई तकलीफ तो नहीं हो रही ना? ठीक है. 2 minutes and 30 seconds.
So, how much does this machine cost, sir?
Machine cost. बोलो भैया. सरकारी.
I think, sir, we have supplied this machine in almost all the government institutes. The cost is roughly around 80 lakh rupees.
80. So that's a government cost, please. 80 lakhs.
80 lakhs.
प्राइवेट में तो आर्म ट्विस्टिंग होती है ना, तो आप हमसे लेके ले सकते हो. 3 मशीन दिलवा दूंगा आपको.
What machine you are using, sir, at your place?
I've got 2 machines, Smith Nephew and Costman.
Sorry, which ones?
Smith and Nephew
Yes.
and Costman.
And what is their cost, sir?
सर हमें मत खुलवाओ सर, मैं इनकम टैक्स वाले नहीं हूँ, आप छोड़ दो. सर वो 14-15 लाख की एक मशीन होती है. सर वो तो 1 महीने में निकल आता है कॉस्ट. हाँ, अब आती नहीं है मार्केट में. अभी 20-25 लाख की आती है.
Sir, any Indian manufacturer do?
नहीं सर,
No.
नॉट सो फार. चाइनीज मशीन एक आई थी पर वो मार्केट से जल्दी निकल गई. Costman. Conventional is like standard, going up to 80-90 degrees. Here it is 60. But this machine can also give conventional RF.
And sir, this radio frequency RF catheter which you put in,
Yeah.
what is the costing for that? How many cases can you do?
No, this is a disposable catheter, so we have 2 needles in it. So this is about 35-40,000. 25,000 rupees.
RF needle,
This kit.
Re-
RF needle is only 1,500 rupees.
1500.
Yeah.
That can be used here. In this.
Normal RF machine. So now, since the facet joint like L45 is supplied from a branch above and branch below. So if you want to do a complete ablation of that facet output, then you have to do two branches. So we've done the L45, now we're doing the L3, L4. L3, L4 facet is normal, but there is a branch which is coming from L3, L4 to supply the L4-5. It
Right.
tweaks from the dorsal MI. So we have to do the L3, L4 too. So we are now going to do the L3, L4.
So this is the RF needle
L5
which has
S1
been
means
put in, which is
L4-5.
costing 1,500 rupees, and the catheter which is ideally supposed to be disposable.
Yeah. You can do a ETO.
You can. How many cases can we use it, sir?
सर मैं तो प्रैक्टिस में तो नहीं मैं रीयूज़ करता हूँ बट मतलब दो तीन क्योंकि ब्लंट द टिप ऑफ द नीडल गेट्स ब्लंट सो इफ यू आर डूइंग ट्राइजेमिनल एंड इफ यू आर हिटिंग द foramen veil wall you may cause some damage. So in a when you are having CSF and all, I don't reuse it, but 2-3 cases you can do.
Right.
Now you see now the दिखा रहे हैं आप? हाँ. So you can see now we are again at the eye of the Scotty dog.
X-ray नहीं आ रहा इसमें. Show the
X-ray नहीं आ रहा
X-ray.
भाई. X-ray
Show the X-ray, Ravinder.
एक्सरे दिखाओ. रविंदर कहाँ गया? रविंदर तो है ही नहीं है.
Anuj. X-ray क्यों नहीं आ रहा? हाँ. Yes sir, we can see.
चलो. अरे क्यों कर रहा है यार? तो देख नहीं रहा तुझे? दिखाओ. हाँ ठीक है. बोल आगे. दिखा. दिखा. चलो. एक मिनट चेक कर. ठीक है. चलो lateral. So we are right at the eye of the Scotty dog. This is a 17 gauge needle. It produces a lesion of 15 mm. Yeah. So you can go spot on, but otherwise if you are using the standard RF, then you have to be lying close, parallel to the bone. Then you can go from a segment below. क्या कर रहे हो? अरे lateral यार.
So
sir.
nothing will change for standard RF also, sir?
Pardon, sir. Pardon. Say it again.
If you are using standard RF,
Yeah.
nothing changes in terms of technique?
No, there is, as I said, that you have to, this is a spot-on needle, tubular tunnel vision, but there you have to go from a segment below and the tip of the needle should be, like touching the bone. So it has to be a oblique insertion of the needle.
Okay.
I'll just show you. एक कोई needle दिखाना मुझे. एक कोई needle है. हाँ. Shoot please, shoot. अरे अब तो वो lateral आ गया ना. मैं आपको दिखाऊंगा अभी.
Right, sir.
शेखर साहब क्या कर रहे हो इधर? हाँ. शेखर साहब को समोसा खाना है भाई. हाँ. Yes. So now you can see the facet joint there. That's the facet joint, and just close by where the needle is there. So just the ideal position for that. आप वो डाल लो. Hello? Impedance 420, 418. So absolutely fine. And ठीक है जी. तो do the sensory now. Sensory. अभी आपको थोड़ा करंट देंगे, आप बताइएगा. कुछ भी करंट आए तो बताए. No, nothing. No, we don't give local. Not now. So 0.4, 0.5. कुछ आ रहा है जी? कुछ आ रहा है लोकल, वहीं पे ही आ रहा है ना? हाँ जी? हैवी लग रहा है, बट लोकली. टांग में तो नहीं जा रहा? नहीं जा रहा. We can increase it a little bit and see. थोड़ा सा और दीजिए. बढ़ गया जी थोड़ा? ठीक है. मोटर. So now there will be muscle fasciculation of the erector spinae group.
Sir, what is that contrast like ring thing we see on the X-ray?
Contrast नहीं है वो ये needle के ये जो components हैं.
What
Probe.
is it? Sorry, sir.
ये probe के components हैं. आप ये कैमरा दिखाइए इधर.
अच्छा, it is the probe component.
हाँ जी हाँ जी. ये देखिए अब.
हाँ हाँ ठीक है ठीक है.
ठीक.
Right, sir. Understood.
तो मोटर हम बढ़ा रहे हैं. कुछ आ रहा है जी? बढ़ाइए. तो आप इधर फोकस करिए थोड़ा. ये फोकस करिए यहाँ पे. ये फोकस करिए यहाँ. इधर फोकस करो सर, फोन पे बात कर रहे हो. नहीं जूम करो, जूम इन करो. बढ़ाइए.
हाँ.
You can see the muscle fasciculation. और बढ़ाओ.
Yes, little bit, sir.
Yeah, now you see.
Yes.
So this is again confirmatory that you are on the middle branch. You can see now.
Yes, sir.
चलो एक मिनट में आपको वो भी दिखा देता हूँ जो स्टैंडर्ड आरएफ दिखा भैया. दिखा. एक मिनट. हाँ एक मिनट. अच्छा दे दो. बंद कर दीजिए मोटर. अब बस. ज़्यादा मत देना लोग. बस बस enough. ठीक. So till we wait for the local to show the effect, I'll just tell you that you have to go. इस यहाँ पे आ रहा है. दिखाइए सर.
हाँ, yes sir, we can see.
So you have to go a segment below.
Right, sir.
And then your needle has to be just parallel to the bone.
Okay, okay, sir.
और दिखा ना. और दिखा. दिखा भाई. हाँ इसे दिखाता हूँ. दिखा. तू दिखा ना भाई. हाँ दिखा. दिखा. So now I have to दिखा. और दिखा. So something like दिखा. दिखा.
Yes, now we can.
दिखा. So here. So it has to be parallel to the bone, touching the bone, so that you get a maximum area for ablating the nerve.
Oh, okay. So there we were putting in perpendicularly in the cool
Yes,
RF.
yes.
Here we are perpendicular to the bone.
हाँ.
Right, sir.
ठीक है.
Understood, sir.
चलो we are now ablating. तो if the other यहाँ पे तो ये करना ही हमने. आप दूसरे ओटी में चले जाए.
हाँ हाँ fix है. Any questions?
Yeah.
Yes. माइक हाँ. ये नहीं उस पे फायदा नहीं है.
Lesion started. We have started the lesioning. Any questions?
So the question is for L4 for L4 joint we are taking the L3 route.
Yeah.
So if we had to go for higher joints we would take one route higher.
One rate higher.
That is the question.
So actually sir, for a one facet joint we are going for a L3, let us say for L4, L5 we are doing two entry points.
Yes.
Two entry points. One
Yes.
for L4 medial branch and one for L3.
Yeah, that is because there is a twig coming from L3 to L45.
The two levels are involved. That is why we are taking two levels.
No, no. Two levels are not involved. One level is involved, but there is a dual supply. It is not just one medial branch. It is the branch from above also sends a twig. So if you are doing only one level, you are not doing the branch which is coming from above.
Right.
So for L45, I'll do L3, L4. Supposing they both are involved, L45, L3, L4, so I'll do 3, 4, 5, 3, 4 and 2, 3.
2, 3.
So for upper twig which is coming below,
Yeah.
can you show the entry point on X-ray?
Same. You have to block the medial branch.
Okay.
Same.
Okay.
Thank you, sir. Thank you.
Thank you.
We will shift to next OT.
Yes.
OT